So, Professor, could you please tell us about your background and what inspired you to pursue an MPH?
Sure. So I went to law school and I thought I was going to be a civil rights attorney and go that route. And I ended up practicing law at a big firm and not doing anything related to civil rights, but actually pharmaceutical defense work for a company that made a diet drug. And I became really interested in the public health aspect of what was going on with all these plaintiffs who were obese. They were speaking to their doctors, but they weren't really talking about their obesity. And I was taking depositions of these plaintiffs and learning a lot about obesity and comorbidities. And I really became very fascinated in the public health aspect of what was going on with, in our country with the increasing rates of obesity. And I actually contacted a colleague who was a lawyer at the FDA, and I said, how do I get a job in the FDA on the food side? And she said, did you ever consider getting a master in public health? And I said, what's that? What's public health? I had never heard those terms before. And funny enough, I did some research and I looked at the websites of public health schools and I thought, this is my calling. This is exactly what's speaking to me. So I left the law and I got my master's degree, and then I ended up working in a food policy and obesity center. At the time it was at Yale. It's called the Rudd Center for Food Policy and Obesity. And I was the director of legal initiatives, and I was doing a lot of what I do now, a lot of academic research, thinking about how we can use the law to advance evidence-based policy in terms of public health broadly, but also obesity and food. And so that's how I ended up getting the master's in public health. And then I really wanted to become a full professor and teach and have interactions with students. And so NYU has been the best career choice for that. I have great colleagues, and there are a lot of collaboration among colleagues, which I think is really exciting, and not at every school. And then we have amazing students, and it's just such a cutting-edge program, so it's been a perfect fit for me in terms of my career.
Well, we're very happy that you're here.
Thank
we're happy
you.
to have you. And so now that you chose the path of public health, what are some projects that you're currently working on?
So I do a lot of work around the First Amendment, thinking about ways that government can increase information in the marketplace to ensure that consumers have valid, factual information about products and services that may cause harm. And then another thing I work on is this concept called preemption. And preemption is when a higher level of government withdraws or limits the authority of a lower level of government to act. And I want to give a few examples so people understand what I'm talking about. Mm-hmm. So a very common example of preemption where everyone agrees it makes sense is the federal government preempts, or it takes away the ability of states to have different laws over airline safety, right? So we have a plane traveling across the country. We clearly only have one law saying there's no smoking on planes. Everyone likes that, right? If we had laws that over every state, it would be silly, right? They would pass over the states and then you could smoke and not smoke, and that makes no sense.
Crazy.
Right. So we need federal preemption to ensure uniformity for something that completely makes sense. In other areas, we've agreed as a country that preemption makes sense, and the main area that is the case are product labels. So when companies make products that are sold throughout the country, food, dietary supplements, even warning labels on tobacco and alcohol, we have a uniform labeling requirements. If we didn't have that, it would be difficult for companies to do business in all 50 states if there were 50 different nutrition labeling requirements, for example. So we've come to accept that that makes sense for preemption. Where preemption becomes problematic is when states, and what's increasing, are states are actually blocking the ability of local governments to enact evidence-based policies. And this is where my work is really focused. So states across the country have been preempting local control over many public health issues And they're not allowing local governments to enact evidence-based policies. Now, we're in New York City, where our local government is really very active, and we couldn't imagine a place where New York all of a sudden took away our right to have a local government act. But this is what's happening across the country. So some examples: 43 states preempt the ability of local governments to enact firearm safety laws. And a large handful of states preempt the ability of local governments to enact food policies. And one of the most recent examples, California, Arizona, and Michigan just preempted the ability, and Washington State, to enact soda taxes. And this is an evidence-based policy, and so it's very worrisome. And the examples are actually very far-reaching, from civil rights, minimum wage, paid sick, even smoke-free air acts. So these are places where local governments are now not able to protect their citizens with evidence-based policy making. And so this is, looking at the legal methods to address preemption has been an area that I've been working on a lot.
I mean, it seems very relevant and also very dangerous. And what can be done to contrast this preemption?
So from a legal standpoint, there are a few times that lawsuits have been successful. It's actually quite rare that there's a real legal case. An example of a successful lawsuit was when Cleveland passed a trans fat ban, which is an evidence-based policy. The state of Ohio did not like that and actually snuck in a preemptive this happens a lot. It's snuck into legislation that's already been down the pike. And so this clause of preempting trans fat bans was snuck into legislation very far into the process. And because of the procedural method that they did that, Ohio, Cleveland sued and won. Now, this is rare. Usually, the states can preempt local control, and the reason is that local governments are actually a creation of the state. And so as though local governments have been in existence since the Constitution was ratified, and as our population has increased, and of course the different aspects of what local governments would need to control given increasing population and complexity involved, local governments are needed to take an increasingly active role, especially in public health policy making. So, but even though that's the case, states still have the authority to preempt a lot of laws. And so that's where it becomes really problematic. So from a legal standpoint, it's actually less easy. And so a lot of people use grassroots organizing to kind of alert legislators and voters of the real issues. And I have to say that the number one way to address it is voting, is actually having people vote for legislators that care about public health. And so getting elected officials in office that are interested in furthering evidence-based policy is really a huge issue, and one of the main ways to win for public health.
Obviously, this topic is incredibly important. What motivates you to keep pushing through it? I mean, it seems like there's so many, obstacles throughout going through this. So how do you keep going?
I actually love public health, and I feel very strongly that everyone has a right to experience the best health that they can. And what's kind of funny is, even though I didn't end up being a civil rights lawyer, I try to funnel that feeling into this. And in fact, one of the papers I wrote had to do with the removal of civil rights action. So Arkansas actually preempted the ability of local governments to enact civil rights laws, specifically, unfortunately, in response to Fayetteville, Arkansas passing an LGBTQ protection of civil rights. So Arkansas state legislator didn't like that, and they actually preempted it. And even just last week, the state's highest court upheld that. And so I think personally there's a federal case to be made here, but this is what drives me, that this is taking away civil rights from people, and that's already a social determinant of health. Discrimination clearly causes health disparities. And so I still am thinking with that hat, but really for thinking through how we can ensure evidence-based policy making so all people have have the best possible way to be healthy. And some of the other areas are paid sick leave. I mean, paid family leave. This country is one of the very few in the world that doesn't really have strong policies. Minimum wage, all these things are really pressing issues that preemption is taking away. So I'm very passionate about it, as you can tell.
No, I can definitely tell. And so what advice would you give to two types of people? First, what advice would you give to MPH students who just graduated and are listening to you and they're like, wow, like I also want to work in this? And then what advice would you give maybe people who looked at your trajectory from maybe being a JD to going for an MPH route? And what would you tell them if it's someone that is on the brink of changing directions or making that switch? What would you say?
Well, so I think that a few things. You want to find your passion on what really interests you. I love my work, and I think I feel very lucky. I love my work. I love everything about it. So if you can find that, you're very lucky. But please don't get discouraged by a bad job or a bad position. There's something important about learning what you like and then where you should be. And sometimes bad jobs bring you to that place. And as you said earlier, like do something scary every day. It's really good. Learn something new every day. So if you're at a job that's not the place for you, try to learn from it, learn something new every day, and then you find your direction. And I think that's really key. I did not find this job overnight. I was practicing as an attorney for several years, not doing what I wanted to do. And I'm doing what I want to do now. So it takes time to get there. And I loved law school. I would never suggest anyone not pursue law school if that is the passion. But public health school is just an amazing education and I think a really amazing view on the world and life. And it's really about community, which in America is sometimes undervalued. We think about individualism and individual strengths, and that's important, but sometimes we forget about community and about the public and the population as a whole. And so I do like that about public health, that we're thinking about how to improve things for a community and not just for individuals. And so I would urge going in that direction for sure. And then, JD MPH is always great. But yeah, so those would be my answers.
Yeah. And so lastly, for your students, if you have any current students watching or maybe prospective students, what is the biggest message that you would like them to take away?
Well, current students, please do your reading, and I want you to keep up with the reading. That's really important because that's how you learn. But I would say that the topic that's going to excite you, it'll be different for every single one of you. Everyone's going to have a different thing that's exciting for them, and you don't need to let it go. Sometimes it's something you're going to do on the side, and sometimes it's something you'll be doing as your career, and then you'll meld the two together and get there. But I really think follow your passion, and I also say I think it's amazing you're in public health school because that is. I think it's a great experience, and as you know, I'm very fond of NYU as a place to get the MPH, and so that and do your homework.
So yeah, do your readings, do your homework, find your passion. Very important. So right now we're gonna check if we have any incoming questions. We don't. Okay. Well, Jennifer, it's been such a pleasure having you here. Please keep us posted about any other big, encouraging research that you find yourself doing. And thank you so much, everyone, for watching. It's been such a pleasure having you.
Thank you so much.